Okay, now we're going to talk about the emphasis and how important it is for the nursing section of family edge teaching. It is so crucial that we have active participation from the very get-go. Nursing can never start teaching as early as possible. The day of admission is really starting to plan towards the discharge. We're going to structure a lot of family teaching around medications, equipment, anything that you're going to need to take your loved one home. So your case manager is going to schedule these meetings for you, and you're going to have as many sessions as needed with your nurse to make sure that you're comfortable in handling every situation possible and knowing exactly how to care for your loved one once at home. The first part we're going to talk about is medications. The medication list for your loved one can be very complicated. It can be cumbersome, it can be confusing, and it can be difficult to manage. What we do here at Magee is really try to make it as easy as possible for you. This includes making sure that you know every medication that your loved one's going to be on once you go home. We're going to make it very simple. We're going to tell you from the very get-go as to what meds they're on, what dose they get, how often they take it, and why they take it, side effects of those medications. It can seem like a lot and it can be overwhelming to a lot of people, but we do our best to give you as many education opportunities so you feel comfortable going home. We also utilize pharmacy here. Pharmacy can put together a teaching packet that can give you very good, crisp, clean information. So when you go home, you know exactly what you're doing and you know exactly what to look for, and you're more than comfortable doing it. We also teach about PEG tubes or gastrostomy tubes. If your loved one has to use a feeding tube when they go home or when they're in the hospital, we'll do our best to show you exactly what you're going to be doing. There's a few factors that play into using a PEG tube or a percutaneous gastrostomy tube. Shorter and easier to say PEG tube. But your family member will have to have their nutrition through that. So what we do is we have nutritionists in-house, and they consult on all the patients. There's certain formulas that we'll use to make sure that you're getting the proper nutrition and to make sure that we're safe in doing it. Nursing's responsibility in all this is to teach you how to take care of that site. It's a site that goes into the abdomen, into the stomach. We'll teach you how to perform wound care around it, how to make sure the skin looks good, how to make sure the tube looks good, and to make sure that it's nice and safe. There are complications that can be related to skin infections and things like that, but we'll walk you along that process, so by the time you leave, you know exactly what you're doing with that tube, you know what it should look like, you know where it goes, you know how to change it if need be, and you know exactly when and what formula you're using to feed your loved one. There's other parts that we teach about in nursing, and one thing is called a tracheostomy, which is an airway that goes into the patient or loved one's neck. This airway provides a patent airway. Most of us breathe out of our mouth. Some people, unfortunately, because of disease or because of injury, they have to breathe safely out of their neck. So what we do with teaching that is we do a lot of education. We have respiratory therapy in-house 24/7. They too will be a part of the education. The nurses will be the ones primarily teaching you how to care for that tracheostomy. There's a lot that goes into it, and it's okay to be overwhelmed by it and to be nervous by it, but we'll make sure that you're totally comfortable by the time you get home. We want to make sure that we teach you what the skin should look like, what that open area looks like at a good time, what it could look like at a bad time. We want to make sure that you know how to change that tracheostomy if you need to do it. We also want to teach you how to suction through it if you need to. Patients maintain their airway and maintain their secretions through this tube too. So with the secretion part, you can imagine that things can get clogged up. Just like when we have a cold or when something and we cough, it can get thick. So we'll teach you how to suction safely. We'll teach you all the equipment that you need to go home with and what to make sure that you bring with you at all times so that you have a patent airway for your loved one and that you're more than comfortable taking care of him when at home. There's a lot of other things that go into a patient here at Magee. one of the main things that we teach about is bladder and bowel management. Bladder management, there's a few ways that we maintain someone's bladder management. One of the ways is called a Foley. A Foley is an inserted catheter that stays inside of the bladder all the time. There's complications that go with that, which would be something like a urinary tract infection. If your loved one, for any reason, needs to have a Foley, then what we do is we teach you how to insert that Foley, how to make sure the site is sterile. We teach you all the techniques to use on how to make sure it's in there, it stays in there, how to maintain emptying the bladder, and what it should look like when this does happen. Another way that we do it is called ICP. That's an independent catheterization. And that's something that we do when someone may have a urinary retention or they're backing up in their bladder. We'll teach you how to monitor to see when it's time to get it done, how to do it, what supplies you need to do it. The timing is very important of this, so we have what we call a pre-void and a post-void residual. We really just want to see the volume of bladder or urine that's in that bladder at one time. You catheterize, you empty the bladder, and then you make sure that there's nothing left over in the bladder so that there is no retention, leaking, and things like that. We'll make sure that you're safe, you're comfortable. Of course, we teach you from very early on, and we'll schedule as many sessions as needed to make sure that you're comfortable while caring for your loved one. Some patients are lucky enough that they can do this by themselves, so we will teach you and the patient as many times as we need it so everybody feels comfortable when you go home. The bowel management, like I said, is another piece of this. People on the stroke, on the spinal cord, there's many complications that come along with this, and one of them is excreting bowel. What we want to do is teach you what the routine is. We want to know what's going to work for you at home. If someone were to have a bowel movement and they need to empty every day, we want to make sure that you're comfortable when you go home, that you know exactly what you're doing. There's techniques to use, which is called digital stimulation or medication management, where it will help things along. But we'll teach you all you need to know about it. We want to make sure that you have the proper technique. We want to make sure that you know the timing that this should be done and what results to expect. You should even know as to what it should look like when it comes out. I know it might sound confusing and it might sound like it's something we're not interested in, but it's a vital part to make sure that your loved one continues to progress and get better. The medication piece that comes along with it will teach you everything you need to know, whether they take it in their mouth, whether they take it in their peg tube, or whether it's a different form and it's something that has to go into the perineal area. There's another piece of this, which is wounds. Wounds are a very cumbersome and very difficult thing to handle at home, especially if your loved one has them. We want to teach you as to why these happen to begin with. Where do wounds come from? What are the complications? How do we get them better? Why do we get them better? And what it means to your loved one and his care. We want you to know what supplies that you'll need. We have wound care here, and we have the nurses, which are all specialists in this. We want you to be comfortable that when you go home, you know exactly what you're doing and to how to change that wound dressing, what medications you may be putting on it, what it should look like, what it's going to look like if there's a side effect or an adverse reaction and there's an infection. We want you to be comfortable that you can go home and know that your loved one is well cared for and you're comfortable doing it. We'll teach you things like seating positions, teach you things like how to turn them every 2 hours if needed, how to weight shift so that there's no pressure on certain points of the body. We'll teach you all the things that go into it, so when you go home, once again, you're more than safe and comfortable and competent to do that. We want you to feel like you can do it just as good as we can do it, and that's really important for all our nurses here to teach you that. The last thing nursing is going to teach you is about any type of supplies that you may need. We'll teach you about the supplies that maybe even therapy will educate you on, and to how nursing plays a role into that. There's certain things that you may use for toileting, for showering, for a lot of the other things, including peg tube feeding equipment, wound care equipment, tracheostomy equipment. There's a lot of different things that all play into it to make sure that your loved one gets better and is safe once they get home. That's what we really want to make sure, is that they're safe and that you're comfortable doing it. So we'll teach you about all the different types of tools, all the different things about equipment that you're going to go home with, and we'll make sure that it's set up and that you're comfortable doing it once that happens.